Thank you. Good morning to all. Today I will present the evaluation of congenital malformation surveillance system in Albania for the year 2015. In Albania, before 2009, were reported officially only spina bifida and luxation congenital of hip. Congenital malformations are the leading cause of infant mortality in Albania. In March 2009, started the implementation of this surveillance system based on an order of the Minister of Health. There is a mandatory individual reporting form for each congenital malformation diagnosed during pregnancy, induced abortion, live birth, stillbirth, early neonatal death, and children up to 2 years old. Up to now, no evaluation of the congenital malformation surveillance system was done before. Some data for the congenital malformations during 2011-2015. Around 170,000 live births were registered during this period of time, and 2,384 congenital malformations were reported to the surveillance system, with a total prevalence of 14.4 per 1,000 live births. The prevalence was higher among males than females during this period of time. Also, the prevalence of congenital malformations among babies born from mothers more than 30 years old was higher compared with the prevalence of congenital malformations among babies born from younger mothers. The main systems affected were musculoskeletal system, cardiovascular, genital system, digestive system, and malformations including oral cavity. The reporting form contained 38 variables, and the main variables are as follows: information about health institutions, socio-demographic characteristics of mother and father, information on previous pregnancies, obstetric gynecologic visits during the current pregnancy, health parameters of the baby with the congenital malformations, risk factor for congenital malformations, communicable and non-communicable diseases. They are all listed in the individual form. Drugs eventually mother has taken during the current pregnancy, and the final diagnosis of the case with the congenital malformations, and currently we are using the ICD-9 coding system. This is the flow of information. All the obstetrician gynecologists, neonatologists, and pediatricians in our country had to fulfill the individual reporting form. And the public health professional working with the surveillance system in the districts monitors and collects these individual forms every month from the public health, from the public hospitals, and reports them every month to the Institute of Public Health, which is the final center for data collection, data analysis, interpretation, recommendations, and the Institute sends regular reports to the Ministry of Health and sends feedback to the public health district directories and to all the hospitals in the country. The aim of this study was to evaluate the congenital malformation surveillance system in Albania in 2015 in order to improve it, and the main objectives were to identify gaps and weaknesses of the surveillance system in order to be able to reduce the number of congenital malformations in our country, and to evaluate the surveillance system in order to modify and adapt antenatal programs. We follow the US CDC guidelines for evaluating a public health surveillance system. This evaluation is focused for the year 2015 and only for the public sector data, because the private sector started to report in the January of 2016. Cases are reported to the surveillance system are compared with the cases registered in the hospitals of Albania. The attributes assessed are as follows: data quality through completeness of the variables in the form, simplicity through structure and ease of operation. 98 physicians were asked about the time to complete the form, flexibility through ability to adapt to new changes, acceptability through the proportion of individuals and institutions who participate in the surveillance system, representativeness through the proportion of reporting with the individual form, and usefulness through trends of congenital malformations and stimulated research. This table shows the percent of completeness of all variables in the individual form, and socio-demographic characteristics, health parameters of the baby, and the final diagnosis was completed in 100% of all cases reported. Meanwhile, information on risk factors was completely missing. This is a passive surveillance system, paper-based, and there is a monthly mandatory individual reporting form. The reporting form contains 2 pages and 38 variables. All the public health hospitals in Albania report to the surveillance system. All the public health district directories report to the surveillance system. There are two types of source of information, the individual reporting form and the hospital registers, which we compare the cases. 100% of reported cases met the case definition criteria, and 92% of physicians need 7 to 10 minutes to complete the form. The reporting form can accommodate to new changes in diagnosis, in case definition technology, and also in each field there is an add option. The system is able to adapt to ICD-10 codes, and the surveillance system was enhanced for microcephaly reporting in the framework of Zika virus transmission, according to the WHO guidelines. The surveillance operates within the existing financial and human resources. All the public hospitals in the country report to the surveillance system. 100% of public health district directories are involved and report to the surveillance system, and all the public health specialists are involved in the surveillance activities. There is a timely reporting from all institutions, monthly timely reporting. The proportion of cases reported with the congenital malformation form is 82%. The overall completeness of all variables in the individual form is 83.2%, and 92% of physicians see the completeness of the form as burdensome that requires additional staff. This map shows the distribution of the proportion of reporting with the individual form. Only 2 regions report less than 50% of the cases, and 2 main regions, and one of them is Tirana, the capital, report almost 100% of the cases. There are differences in the reporting between regions. Cases notified by the surveillance system represent 82% of all cases of congenital malformations in Albania. The system provides data to the maternal and child health programs, and the system recently was used for designing neonatal screening programs. The surveillance provides data over vital records when studying infant mortality in children with congenital malformations. The surveillance was able to detect trend over years by time, person, and place. A TAIEX workshop from European Commission was organized in Albania for the surveillance of congenital malformations and preventing congenital malformations. The surveillance system is population-based and provides information for descriptive and etiologic studies. And the system provides information to public health experts, health professionals, policymakers, and to the general public. This is the first evaluation of this surveillance system in Albania. The overall representativeness is 82% of cases are detected by the surveillance system. 4 regions report less than 70% of the cases with the individual form, and 2 regions report less than 50% of the cases with the individual form. 83.2% is the overall completeness of all variables in the individual form. There are missing data on risk factors in the reporting forms. There is 100% participation of all public hospitals. There are no data from private sectors up to 2016. So we can conclude the surveillance system is rather simple, flexible, and provides useful data. Our main limitations are that we are not able to conduct a survey for directly evaluating the perception of stakeholders for acceptability and simplicity, and case ascertainments according to medical records was not implemented. The main recommendations of our study are to improve reporting of risk factors among all cases through a specific law or regulation, to introduce regular and periodic case ascertainment procedures, to implement regular trainings for the staff in public health district directories regarding the surveillance system, to continuously train the physicians about the importance of reporting congenital malformations and the use of epidemiological data, and to raise the awareness of the physicians about public health importance of the risk factors. I would like to thank all those who helped me in this study, the supervisors, the scientific coordinators, and thank you for your attention.
Thank you, Dorina, for this interesting evaluation of the system. I will leave now the floor for a question. Please go ahead.
I would like to thank you for this excellent presentation and this very nice study conducted related to the evaluation of your system. I have a question related to the representativeness of your system. Do you conduct a specific study or to assess this?
Yes. The public health professionals in each public health district directory do the case ascertainment. They collect the individual reporting form, and also they verify the cases reported with the form with the cases registered in the clinical files and in the registers of the hospitals, and they report to Tirana. I, with my colleagues, personally, we have done this for the capital, Tirana only, but the public health specialists working with the surveillance system in each district, they did the case ascertainment to assess the representativeness.
Hala?
A nice presentation. What's the proportion of home deliveries there, and if there are some non-fatal congenital malformations which are happening at the home delivery, how do you capture them?
I'm sorry, can you repeat?
What proportion of deliveries there are home deliveries, not institutional deliveries? If some home deliveries are happening, deliveries at home, house.
Outside the hospital, delivery outside the hospital.
Okay.
Non-institutional deliveries. And
okay.
Just I'll finish it, okay? If there are some fatal congenital malformations among the deliveries that are happening at the home level, how do your system capture that?
Thank you for your question. Yes, we don't have deliveries, births outside the hospitals in Albania. We don't have for about more than 10 years. And regarding the fetal deaths with congenital malformations, was the second question?
How can you catch these cases if they're outside, institutional?
Well, first of all, we don't have, how do we catch the cases that they are all registered, even fetal deaths are all registered in the hospitals of Albania, public or private. And they register also the cause of the death. And for that they fulfill if the cause of the death was the congenital malformations, they have to fulfill the individual form. But of course, we have some underreporting.
Thank you. Now we go to Hala.
Thank you, Albanian colleagues, for such amazing systems. I was wondering regarding, have you noticed any decrease in trends of congenital malformations after the legalization of the abortion law, or there was no link between the two? I don't know, in your study?
Actually, the surveillance system is quite new. It started in 2009, and prior to that were reported only 2 malformations. And of course, there are malformations because of induced abortions, and we are not able to detect an increase in trends before the legalization of abortions.
Thank you.
Any other question? Okay.
Thank you for a very nice presentation. I have to thank also your previous speaker for a very nice presentation, because my question is about the two, in fact. In both of these maps, it's shown that in southern part of the country, the surveillance systems perform better than in northern part of the country. So it can be kind of meta question how to improve performance of both systems in the whole country. Thank you.
Yes, thank you. Actually, from 2009 up to now, the central and south of Albania continuously report better to the surveillance system. But unfortunately, due to financial problems within the institute, we were not able to do regular or periodic monitoring in all the districts of Albania, but we are planning that now. So we need to, and also there was for about 5 years lack of trainings that we could offer to them. But we have a plan now, together with the Ministry of Health, to raise the trainings, especially in the north of Albania.
Okay, thank you very much. I'm Gens Burazeri, the national focal point. And a general remark for both Alba and Dorina. As you know, we are right in the middle of working on this ICD-10. And in that framework, it comes back to what Alba presented and more recently Dorina. We are, so to put it in a nutshell, right in the middle of revising. It is going to be a full revision of the abortion form, birth certificate, death certificate, fully in line with recommendations and guidelines of the ICD-10, and it goes back to what you, Dorina, presented, also introducing a form which we unfortunately don't have yet. That's the perinatal mortality form, and many of these points will be addressed eventually in that, because as a matter of fact, our current system has a lot of flaws and limitations. So I agree with Nana's remark earlier, Alba, and therefore all those concerns will be addressed eventually with the amendments and introduction of this perinatal mortality form. Because it goes back actually from the birth certificate where we'll introduce these, we have these adds-ons with regard to birth defects, congenital malformation, and then it goes to abortion form where we have these new, not only coding, but also new dimensions, parameters, and eventually in the perinatal mortality form, which, to be honest, it is true that we have institutionalized all births on the face of it. I'm not sure that's 100% true. And in any case, even if it's true, still the form needs too much to be desired. And therefore, on the face of it, you have done a great, absolutely gorgeous job, but still the system needs a lot of adds-on. Thank you.
Thank you. Okay.